Virginians should know that we have long-standing plans in place to deal with pandemics. We have trained for them and we are ready for this.
March 12, 2020. Governor Ralph Northam declares a state of emergency in response to the coronavirus.
I'm taking the lead on this, but we will do everything, continue to do everything in Virginia to keep Virginians safe.
Within 2 weeks, schools are closed, as are gyms, beauty salons, and restaurant dining rooms. On March 30th, the governor asks everyone who can to stay at home. Since then, more than 25,000 Virginians have been diagnosed with COVID-19. Over 3,300 of them have gone to the hospital and 891 have died. And now, 2 months later, we're on the verge of slowly starting to reopen. The governor has always said testing will be the key to doing that, ultimately setting a goal of 10,000 tests per day. On April 20th, he announced that former State Health Commissioner Karen Remley would be leading a task force to ramp up testing. But weeks later, Virginia continues to lag behind just about every other state in the country when it comes to the percentage of people tested for COVID-19. According to the latest data from Johns Hopkins Coronavirus Resource Center, Virginia has the third lowest testing rate of all 50 states. And a comparison from the Kaiser Family Foundation shows the same. Dr. Remley was brought in 3 weeks ago to try to ramp up the testing rate, and I keep checking the Johns Hopkins Coronavirus Resource Center to see where we rank compared to other states, and we're still at the bottom. So I'm wondering why that is. A lot of our viewers keep reaching out wanting to know why is our testing rate so low compared to other states.
We're at 9,801, which is 199 tests from 10,000. And so I'm very pleased with the progress we're making. I make no excuses for Virginia. I think we're in a good place.
The Johns Hopkins is a cumulative amount of tests. So we will never catch up unless we inappropriately just tested everybody in the state, which wouldn't give us information that would help with public health.
The governor has consistently blamed a lack of supplies from the federal government for testing issues. Virginia placed an order for 500,000 nasal swabs from the federal government in early March. But the Fed said that was too much and reduced the order. Virginia Department of Emergency Management head Dr. Jeff Stern.
We then tried to purchase swabs from a private vendor. We initially issued a purchase order for about, I think it was 100,000. And then a week later, that distributor came back and said they couldn't get the swabs.
Stern says VDEM has since received supplies from FEMA, and yet Virginia still has not reached the governor's goal. Over the past week, we've ranged from between 3,700 tests a day to a high of 9,800 on Monday. But by Tuesday, that number dropped to just under 3,500. Senator Mark Warner is on the president's task force to reopen the economy. Well, he says the federal government deserves some blame for not providing PPE and testing supplies to the states. He has the same questions our viewers have about why the Commonwealth has not done a better job. What is your sense of why they maybe got more supplies, or did they ask for them sooner? Why is Virginia behind these neighboring states?
Well, those are questions I want to get the answers to as well. I do wonder at times whether we've made sure we've taken an assessment of all the testing capacity we have in Virginia.
To that point, we contacted many of the private labs that have testing capabilities on the state's list for doctors, like Aperiomics in Northern Virginia, who had a large supply of COVID-19 tests available nearly 2 months ago. So then on March 20th, did you start contacting the state or hospital system saying, hey, we've got this test now?
We did reach out to the state and let them know that we had testing available as well.
In fact, CEO Dr. Crystal Eisenhower says Aperiomics currently has 3,000 collection test kits just sitting in a warehouse. But she says the state never tried to buy them. If you had these testing kits on hand that included the nasal swabs, et cetera, and you had made the state aware of that, then why did they not take advantage of the supplies that you have?
I don't know. I honestly don't know.
From your perspective, Why do you think Virginia's testing rate is one of the lowest in the country? Bottom 3.
I think there just wasn't early and aggressive guidance from the state in order to communicate to the healthcare providers. I have healthcare providers that come to us and they're confused. They don't know what to do. They don't know which tests to run. They don't know who to trust. They're getting bombarded by all of these companies that want to do COVID testing. And I think there's not been a consistent voice and a consistent guidance helping the healthcare providers understand, who they should trust as far as testing goes, who they should, go to, who should be tested. So I think that has really been a big part of the delays.
We asked Dr. Remley about the Aperiomics tests. She said they cost significantly more than some of the other tests on the market, so the state opted to contract with other private labs to improve testing supplies. Governor Northam says some new public-private partnerships will be announced soon that will further ramp up capacity. Adding on to that point, state officials now say they have sufficient funding as well as supplies to do testing. However, they still need to hire hundreds of contact tracers. Working for you, I'm Melissa Hippolyte for CBS 6.